Okay, good morning, everyone. It is with a great pleasure that I welcome you in the 8th session, the launch of the Patient Stories book. And this remarkable book is a collaborative effort between the World Patient Alliance and the Elsevier Foundation. And I would like to invite Professor Bettina Boris to be the chair of the session. And Professor Bettina Boris is a global public health expert, and she has a long experience in collaborating with international organizations, both at the United Nations level as well as the European level. She is the CEO of the World Federation of Public Health Association. She also served as the president of Europadona and holds board position in various public health organizations. So please welcome Professor Bettina Boris.
Thank you. Thank you, Inge. Thank you so much and good morning. Indeed, you heard I'm public health. I mean public's health, all our health. That's what we are doing all here in the room because we are all experts of our health, of global health, because only together we can live healthy lives. And we have heard that even patient safety, and this already depends on our collaboration. We heard this very frequently. Health, if we talk about it, we sometimes say it's too important to leave it to doctors only. And when I say that, I mean that we are thinking of the determinants of health. And the determinants of health are mainly outside hospitals. They are the environment we live in. They are the social justice. We also have to say that peace is an important factor for health. And all these determinants, we used to call them social determinants. But one of these determinants is also, you heard it the whole morning, education, knowledge. Knowledge is a very important factor for being healthy, staying healthy, and having a healthy surrounding. So knowledge starts where? We heard it. It starts early on, when we are still kids, when we are still, learning everything. And that's where we grab our knowledge. And we heard about the possibilities to teach children basic knowledge about hygiene, about healthy living. And I can tell you one thing, and I think you know it all. Children, once they have learned, they can be terrible messengers. They can tell you, Dad, you don't do that, and then you will behave, because this is, I think, a second point of teaching young people that we have not yet mentioned. They are excellent messengers. I have been, and I'm still very active introducing mammography screening all over Europe. I'm still not successful in my own country, Switzerland, but Switzerland usually takes 100 years longer to get things done. That's what we call stability, And in one country of the EU, we had, let's say, problems to reach the difficult to reach. It was Greece. And someone had the idea to say, look, we give the school children the flyer that invites for mammography screening. And these school children went to see their grandmas by saying, you have to go to do this. We learned that at school. I can tell you that the participation rate in the mammography screening program went up like this, just to talk about the power of children as messengers. And I could tell you something else. They're not only messengers, but they are also psychology reassuring people. In my first life, I'm a trained histopathologist, and you know that pathologists look through the microscope, and 80% of our work is diagnosing cancer, you know, not really pleasant. Very unfrequently, people ask to see their diagnosis, to come and to see. And I think it's a good thing. A friend of mine wanted to see her tumor with me under the microscope, and she came with her daughter, I think 10 to 12 years. I was a little bit afraid, not knowing what this young girl would make out. I explained here under the microscope, this is a tumor, this is mommy's. And she asked questions very clearly. Oh, the blue dots, that's cancer. Yes. And this is out now. Yes. Okay, good. And this one, I said, these were lymph nodes, little nodes here. And they're out now. Yes. So she took mommy's hand and said, this is okay. Your tumor is out. I think it's interesting that knowledge they grab is directly translated into action. There is not this long thing that we are doing, but directly going into action. And I must say that this reassured me also to show tumors again, also to younger children. I'll stop here with the stories I could share with you about the messengers and supporters that children can be, or young adults then later on. My task is, in fact, a completely different one, but it's a non-task because I have to introduce someone everyone knows in the World Patients Alliance. He is part of the 3H that we learned yesterday. Hussein, please come up. Everybody knows him, and he promised me to take me, a mountain fanatic, to Pakistan mountains. So here in front of a large auditory, this is your promise? Good. Okay, then now you can come up. And another committee has been applauding you on your new haircut. We wanted to applaud that. We support men who take care of themselves. It's part of healthy behavior, you know. Thank you.
Thank you very much, Bettina. And you know, I'm having problems with my family, with my pony, and you know, they are not happy with my hairstyle. So I wanted a reassurance from her and Lace, you know, just to let my wife know that's not looking so bad as she thinks they were. So thank you very much for supporting this. And my, you know, I can even track to K2 with you, so that promise still stands. So coming down to this children book, so the idea started way back pre-COVID in 2019, I believe, when myself, Helen, Regina, and Lace, you know, we were in Saudi Arabia, and we were going out for a night dinner in the bus with everybody. And you know, Lace just started, you know, she's a very good talker as well. She started talking, and you know, it just started from that bus tour. And we thought, you know, if we involve kids, as Bettina just mentioned, that message can stay with them for the whole lives, you know, if it becomes part of their, you know, personality as well. So this was the idea. It started from there. And then, you know, you know, we were struck by COVID, but then, you know, it was a little slow process, but here we are. And, you know, I'm very glad that, you know, we managed to, you know, achieve this. And I must tell you, the force behind all of this is Liz. You know, she is the one who actually made it happen and really forced us to, you know, get these books finalized. And you know, so I will be. So Lace basically is from Elsewhere Publications, you know, one of the largest healthcare publications, all these academic journals. So Lace is Gencura. She is an MBA in Healthcare and Innovations. Then she is working as a Quality, Patient Safety and Innovation Manager and member of Clinical Best Practice Elsewhere. She's also a Scientific Council member, Emerging Diseases Task Force member. So she has a lot of, you know, all of these things. She's also honorary member of the Patient Safety Foundation in Chile and an associate member of International Association of the Innovation Professional. So I would be requesting Lace to come and tell you more about this project, what we have done. And once we have done that, then we'll inaugurate those great books. So, Lace, over to you.
Thank you so much for the very kind introduction. And I am indeed a very talkative person. As some of you might have noticed during the breaks, I've been talking to many of you. You said I'm the driving force behind this. It's very easy to drive a force when you have a council like the council that we have in the editorial board. So I would say we're all the driving forces of this. Well, this is a little bit about me, and this is also a little bit about me a couple of years ago. I had my first misdiagnosis when I was 5 years old, melanoma that never was, thankfully. And it was my mother that actually went for the second, the third, the fourth opinion, and then we realized it was a misdiagnosis. My mother is also very engaged in patient safety. She's held many different positions in patient safety in Brazil and even Joint Commission International. So I would say I started very young in this area. Now, I do want you to think about the first time that you had a first direct contact with patient safety. For most of us, this is a traumatic experience with either ourselves, a loved one, or if you're a clinician, a patient that you might have lost or that had a sentinel event. What if we could change that? What if our encounters with patient safety would start at an earlier age? Just like when we learn how to brush our teeth. What if we could incorporate patient safety as a habit for the future generations, much like the work that Mikaya is doing in Saudi? I was very happy to hear that, Mikaya. We need to talk. So we have evidence that shows that teaching them young can lay the habits of a lifetime. We have lessons from the recycling movement. I actually learned how to recycle with my son. Nutrition programs in school with great outcomes, and also financial education. We're seeing many more programs now raising with financial education. So as Hussein mentioned, in 2019, we had a moment of serendipity. We were all together in the same bus, and yes, I started talking. And we realized that we could empower the community to act for safer care through the education of children by developing this children book series that supports education about patient safety. That is the whole idea behind those books here that you will see in a bit. So what we wanted to make sure that we had were stories that embrace representation. That's something very important. So we have characters from the Americas, Africa, Middle East, Europe, Asia, and hopefully we'll have many more, including more diversity and more inclusion. These are only some of the characters that we have in our stories. And then we have our superhero, Dr. Safety. She is the person that shares knowledge with the children about patient safety. So what are the story arcs of those books? It's a simplified version of the hero story, the hero's journey. So all the children will start with a normal day. So they're just going on by their lives. And then they will face a challenge or a temptation. For example, Lucas, on the first book, decides that he's not going to wash his hands that day. And then they meet the mentor, Dr. Safety, and she ultimately shares knowledge with them, and that drives transformation. And then we go back to our hero, and they become a member of the Safety League. So the idea is, normal day, you face a challenge, you meet your mentor, and you get transformed through knowledge. We have 3 available books already in print: the hand hygiene book, the understanding your health book, and the medication safety book. 2 more are already on print, which is the injection safety and the cold flu and antibiotics one that focuses also on antimicrobial resistance. And now I'm gonna pause for a second. And again, this project would not be feasible, would not even be thought about without the real driving force behind this, which is the editorial board. When we were in Saudi, I was giving a workshop and I saw Helen sitting at my workshop. And of course, my legs suddenly trembled. I said, oh my God, I'm presenting to Helen Haskell. Okay, that's a whole different ballgame. So after that, I went to their session and Regina was presenting on children. And never in my wildest dreams, I thought I would be calling Helen Haskell. Hi, Helen, how you doing today? Or Hussein Jeffrey, hey, Hussein, how's it going? Or Regina, are you ready to review another book? So it makes me very happy to have them on the editorial board. We also have a children's book writer, Trishane Tavares. She was actually my primary school teacher. So it was a return in times. She met me on the first version of the photo that you saw. Tiago Dalcin, Dr. Tiago, he's a pediatrician at one of the largest hospitals in Brazil, and he was responsible for making sure that those books are evidence-based also. Then you have me, you already know me by now, and Pedro de Luna, our illustrator, and the one that gave life to our characters. I would also like to recognize the Elsevier Foundation, who believed in this idea, who bought this idea, Ilumscan, Domisiana, Franciscon, and Maha. They really helped, supported us. This is a 4-year project, so we're talking about many years of resilience. We had a COVID pandemic in the meantime, so I'm very thankful that they believed in this idea and they kept pushing us also. Now comes the most important slide of this presentation, which is the slide where you have the QR codes to scan, to print, and distribute the copies. One important thing is the license that we have for those books. We wanted to make sure that the books reach the children, right? The most number of children that we can get. So the license that we have behind this is that anyone can print copies. They can distribute copies. The only thing that you cannot do is to sell them or to change the content. Other than that, feel free to download, include your logo, distribute with the people. You can do it digitally. You can do it in print. I'm looking at you, Ravi. Hi. Social media. Have you scanned it? So what we want to make sure is that this reaches the most number of people. And of course, translations. We are going to have 5 languages prioritized, but please, if you want to translate to local language, do it. Do it, share with us, and we're going to upload the translations into the Elsevier Foundation website and also the World Patients Alliance website. We need this to get to as many children as we can. Mikaya, I'm looking at you. Hi. So we want to make sure that this gets to the children. So I could not reinforce that more. Please, please, please share this. And I'm gonna finish with a quote from Linda Creed, which actually is known by Whitney Houston. But it was Linda Creed. It's just like the Uncle Ben and Voltaire from yesterday, right? Which is, I believe the children are the future. Teach them well and let them lead the way. Thank you.
Thanks a lot, Liz. And I think we are already now planning the next phase of this project. We are in the talking process. We would like to maybe run this project in schools. So go there, do a survey of the kids, take their current knowledge, then, they go through this book, and then we do a post survey and see, has it made a difference? We are also looking at, these books to be narrated, you know, a grandmother or somebody is, reading it out to a kid, that those sort of videos so that kids can also look at that because sometimes, even my kids, they are not interested in reading much, they are more interested in video and visuals and all of those things. So we are already started to think about the next steps of the project. So, but now we would like to launch these books. So we have the books. Yeah. So can I request Helen, please come onto the stage? Can I also request the board of directors to please come onto the stage? We just have to take a picture. Yeah. And perhaps also our advisory board members who are present, if you guys can also join us onto the stage. Vildana, yeah, indeed.
English, we have to